On that note, I think we should get started. And so I'd like to welcome everyone. And I'm going to mention that after the hiatus, the COVID, the One Health Social Sciences Initiative, we've regrouped and we've restarted. And now we are here at post-COVID. We had our first membership meeting on April 12th. And at that meeting, we were so privileged to have our guest speaker, Dr. Cheryl Stroud, who is Executive Director of the One Health Commission, join us. And she provided an overview of the history of the One Health Social Sciences Initiative, where it is currently, and a vision for the future. And as well, we provided everyone with an overview of the relaunch of the One Health Social Sciences, our updated vision and mission statements, and an introduction to our action-based working groups. And really importantly for me to share, as it relates to these working groups, we've mentioned that we'd like to welcome new members and that we'll be sending out a survey for this. And as an update, the survey has been finalized, it's been completed, and we'll be sending it out within the next week. So keep your eyes open for it. And we're also interested and open to having new working groups should you have a special interest in developing a working group on a specific topic, perhaps leading it or being a member of it. And so for certain, you can demonstrate that interest in the survey. And for example, our guest speaker today, Colleen Dell, she reached out to us after our membership meeting and offered to lead a new group, a human-animal bond working group. And so she'd be very happy to have members join her for that. So if you're interested, again, please do our survey. I'm the lead for the webinars and presentations group, and I'd love to have some help. So if you're interested in joining me for that, please do. And on top of that, I could use the help because I'm interested in leading another working group as well, one on climate change. So again, watch your email. And if you're interested in taking a deeper dive into the One Health Social Sciences and you'd like to help us move our efforts forward, please let us know that you're interested in that survey. It's a really great opportunity to demonstrate your leadership in a very unique way, and you're going to meet endless numbers of so interesting people. So it's so multidisciplinary and of course global, so you meet the most fantastic people. So there's so many tremendous benefits, I think, participating with this. It certainly has been my experience, so you take it from me. And on that note,
I'm just going to put a timer on me here so I know. Okay. And I want to start by acknowledging the land and everyone for being here. I'm in Treaty 6 territory, homeland of the Métis, or Saskatoon, Saskatchewan, Canada. And if you have any animals with you as well, such as I have Molly here, it's early in the morning, so she's had some cookies and she's going to sleep for the rest of the time, I'm sure. I think it's really important that we acknowledge, obviously, the animals, the humans, and our environment and our land that we're sharing as well, given our One Health focus. So during my 30-minute talk, titled Exploring Zooeyia, the Benefits of Human-Animal Interaction, I encourage you to think about your relationship with companion animals and other animals as well, what this offers to you and what it offers to others possibly, and the acknowledgement of this relationship from within a One Health framework as a social scientist. So I'm going to talk about 4 things. Be pretty simple. I just want to give everyone just this broad overview. I'm going to start by setting the context of pets around the globe, a little bit of a few examples, and from a Western lens mostly, but because that's where I'm coming from, but we are going to talk more globally as well. Give you a brief introduction to our own research lab and some of the terminology I'm going to talk about today. Then I'm going to turn to defining Zooeyia and as a One Health approach as a social scientist. Then we'll talk about the human-animal bond a little bit and how this expands, at least my understanding of Zooeyia, because it brings in that reciprocal relationship, that back and forth that we do have, in particular with companion animals. And then throughout and at the very end, I'm going to offer some resources. So let's make sure I can flip. There, good. Okay, setting the context here. Think about your own relationship. I'd like you to think about your own relationship with companion animals in your life. If you have one or if you had one in the past, if one is joining us today, maybe you can let us know in the chat. This is a photo of my husband and myself in Kidsby. This is a requiem session. This was as Kidsby had cancer and she was passing, and we had a photo shoot to recognize her life and honor her. And I just love this picture because I really think you can see the reciprocal nature, the bond, but it's not just going one way. It's coming from her as well. And that's really important here, and this is key. So in North America, 63% of households have a companion animal. Of course, this is going to vary across the world. This is going to vary across cultures as well as the species of animals that are considered pets. So if you think yourself, if you have a companion animal or had a companion animal in your life, just think for a second what this means to you. And I would say go to the chat. You can put it in the chat because you will all be able to see your answers. I can't see them right now. Unfortunately, that's okay. But yeah, maybe you can throw a few things into the chat. So if you had or have had an animal in your life, a companion animal, or what some refer to as a pet, what does it mean to us? Or maybe clients you work with, other people you know that have pets. And I'm just going to assume that some of the words that are coming up in the chat or that you're thinking about are things like love, non-judgmental, supportive, always there, family, right? So in Canada, we had a recent question, we added a question to a national survey, and we found out that 88% of respondents considered dogs to be a family member. 88% of respondents said that dogs contributed to their emotional well-being. And 72% said that their bond with a dog could be as strong as their bond with a human. This is huge, right? And we haven't published this data yet, and we have this from other parts of the world, other surveys. So this is a national survey in Canada. So the role of companion animals in our lives, and for us, we were talking here a lot about dogs, is really, really important. We also had a student recently in our lab, Abu Hana Mustafa Kamal, one of my MA students, and he looked at the role of caretaking of pets in Bangladesh and found one of the first study looking at that, and found that there is a social, psychological, and physical health benefits for people in Bangladesh to integrate animals or companion animals into their lives. So the key point here is just that many humans see animals as a really important part of their life and that relationship that they have with them. Here's a few stats from around the world here. Across the world, dogs and cats are the most common domestic pets. In the US, it's the top country for both dogs and cats, 70 million dogs approximately. And we're looking at 74 million domestic cats, a few more, same here in Canada. Another fact I found that Brazil has the second most dogs of any country with 35 million domestic dogs. And also they have the largest number of animal species that are considered pets, and that's likely because the Amazon is right there. Another interesting fact is that the pet industry in China has really increased in the last 10 years. It's second in the world in terms of the number of cats owned as pets. And I believe there is something around 53 million cats. In Canada, in comparison, we have around 8 million dogs and again, slightly more cats. A couple more facts. Fish are the most popular pet in the UK. And India has the fastest growing dog population in the world. So again, obviously lots of variation across the globe. And that's what I think makes it even more exciting and to think about this. So just a really quick introduction to our lab. We study human-animal interactions in a research lab at the University of Saskatchewan. I've been doing this since 2013. 2013 with dogs as a focus. Prior to that, I've worked with horses as well. And then in 2023, Dr. Lindsay Williamson and myself and Dr. Darlene Chalmers, all here in Saskatoon, created the Positive Connections Lab. So we do look at the human-animal bond, and with a lot of focus on mental health and addiction. And I'm not going to talk a huge amount about this today, but I will. But animal welfare is absolutely key to everything that we do. And it is that reciprocal relationship when you look at the human-animal bond. So just, again, our research partners here, lots of individuals. We work a lot in the community. And yeah, I want to acknowledge that, including the animals, because without them, definitely would not have an understanding that we do. So I want to put this up. As I said, our lab primarily focuses on canines because of the first, their popularity, which I just showed you some of those numbers, and also the longest history of domestication. So I think there is so much to learn there, especially about the human-animal bond. And this is a webinar from Dr. Robert Lousy. He's in Alberta, and he showcases that strong scientific evidence base for the human-animal bond. So if anyone doesn't know of his work, this is an excellent webinar he did for our service dog work. I mean, you can find it here. And then I just want to give a couple of definitions because this could vary across the world as well. But today I'm going to talk about therapy dogs. Therapy dogs are dogs that go into situations or environments where you typically don't see a dog. So for an emergency department at a hospital, universities, visiting with students, visiting with the elderly in care centers, that would be a therapy dog. A service dog, these are specially trained dogs that assist people with their daily living, and which we would typically say with disability. So a seeing eye dog, dogs that work with veterans with PTSD, that would be another example of a service dog. And then there is the companion animal category, or also known as pets. And these are the animals that we live with. Whoops. I just wanted to put this article up as well, because I was thinking this may be of great interest to people. This is a recent article coming out on terminology around therapy dogs, service dogs, and education. So you might want to have a look up at this one. So now it's all coming under the umbrella of animal-assisted human services. And then on the one side, you have the service dogs. And on the other side, you have animal-assisted services. This is where you would find therapy dogs and so forth. Anyways, it's an excellent article to get a lay of the land, because even if you do a Google search or you get into looking at the literature, so many different people are using different terms, and I really like what they've done in this one. And this just came out in 2024, so have a look at that one if you want. Okay, so moving on to Zooeyia here. This was a term coined by Hodgson and Darling in 2011. They are Canadians, and we've worked with them quite a bit. And the definition here of Zooeyia is the positive benefits for human health from interacting with animals, focusing on the companion animal. So Zooeyia really is the opposite or the inverse of zoonosis, so animal disease transference. But Zooeyia is that other side within a One Health framework. So I think what's important here is it focuses mainly on companion animals, that definition of Zooeyia. So I'm going to stick to that today. I'm not going to focus on farm animals, for example, but farmers do and can have very strong relationships with the animals, but that's not what we're going to focus on. We're going to stick to companion animals. I also want to point out here that there's an alliance between One Health and an Indigenous worldview. So both are holistic in their accounting for the animal, the human, and the environment to achieve wellness for all. So my background is in Indigenous health. I did a lot of work in that area. And when I learned about One Health, I was like, oh, this is very similar. And it was all making sense to me. So this is from one of our projects. And Elder Jim Dumont this is the definition of wellness. From an Indigenous perspective, as a whole and healthy person expressed through a sense of balance of spirit, emotion, mind, and body. So central to wellness is beliefs in one connection to language, land, beings of creation, those animals, and ancestry supported by a caring family environment. So what's really important here is that the animals are being recognized, whereas for us in a Western definition of health, it usually is just the absence of disease. So this makes so much more sense to me and very parallel with a One Health approach. So Dr. Darlene Chalmers and I wrote about this overlap, especially acknowledging that Western model and One Health. I guess One Health within the Western model is not really all that new. And this would be true across the world and across different cultures. So I just want to make that recognition. It's really important when we're talking about it and we look at all those overlaps. So Dr. Chalmers and I also wrote in that article about this expanded understanding of environment within a One Health framework as a social scientist. So let's say you'll see in this picture here, if this was an animal-assisted human service, you have the animal, the intervention, let's say the dog, and then you have the human, let's say the dog is visiting at a senior's care facility because the individual had to give up their pet to move into that care facility. And the dog is providing great things. We're going to talk about that in a minute. So they're interacting with the human, then you have the animal. And then on the other side here, we have the environment. And we broke up environment, and this is just something for you to think about, into three areas. So one is the physical or the natural environment. This is more the biophilia hypothesis. And this is where we're looking at a connection with animals and with nature being innate to us as humans. And it's really this fundamental biological need that we have. And it really is this instinctive bond that we have as humans with animals and other living systems as well. So we talked about the natural environment. Then we also talked about the social environment that individuals are healing. For example, if they were in a care facility, a senior care facility, maybe they were healing from a stroke and they need to reintegrate or connect with their own families, communities, and society at large. So that would be our social environment. And then we have our built environment. And this is, for example, the way that a building is arranged and how it operates to determine that interaction and bond you can have with an animal. So I know we did a study with therapy dogs at a seniors care facility here in Saskatoon, and they have the Eden philosophy. And the Eden philosophy is making sure that how it's set up, how it is designed, is really conducive to people interacting with animals. Animals that people bring in and animals that live there as well. So again, you can look at this article here if you're interested in any of that. So just expanding our understanding, and I think that's what happens when we think of One Health in this Zooeyia lens, right? So this is the 4 components of Zooeyia that Hodgson and Darling spoke about, and they proposed in 2011. They saw pets as builders of social capital. So pets can create, for example, a sense of belonging. This is what the literature is telling us. Feelings of happiness, security, self-worth. They also saw animals, pets, as an agent of harm reduction. I know there was a study here by Michelle Lem in Ontario where individuals, young people who were living on the street, did not have a home, but they had a pet. They were using less substances because they wanted to make sure that their pet was safe. So that's just one example of reducing harm. The literature also tells us that pets can help in being motivators for healthy behavior change. For example, having to walk a dog will get individuals out. We know that there's studies on seniors who will eat regularly if they are feeding their own pet regularly, which they will remember to feed the pet, but not necessarily themselves. And then also as participants in treatment plans, we know that petting a dog for 10 minutes, my pretend dog here, petting a dog for 10 minutes can help lower our blood pressure, can increase our oxytocin, which are those feel-good hormones, even create a stronger therapeutic alliance with a care provider. So that's Zooeyia. Again, the benefit of animals in our lives, and in particularly, they have focused on pets. So Zooeyia is awesome and we use it in a lot of our work and we fit within this framework, but it is very, in one way, species specific, or it is about the influence or the impact of animals on human health. But what about the impact on the animals themselves? And again, that reciprocal relationship. So bringing in the human-animal bond and identifying that it is a reciprocal relationship, like you spoke about earlier in the chat, I'm assuming, and that you saw in the picture of Dave and myself in Kisby there, is this give and take, right? Recognizing all that within speciesism and that's humans have a lot of control over animals, but the human-animal bond is one way to start to dismantle that. So here's the most common. This is from the American Veterinary Association. A definition of the human-animal bond. And right up top, there is a mutually beneficial and dynamic relationship between people and animals that's influenced by the behaviors that are essential to the health and well-being of both. And that is the key point here, is that mutual give and take and so forth. I think we can argue, can it really be mutual, or how does that play out again, because we have so much power as humans over animals. But I'm just saying here is that initial recognition is this give and take in the relationship that we have with our animals. So there was a study, a systematic literature review in 2023, and it was reviewing measures of human-animal interaction. And so within that, there were measures of the human-animal bond that was found. And I just want to share this because it really kind of brings that point home. They concluded in the systematic review that there were available scales of human-animal bond, but it really focused solely, almost exclusively, on the human experience and perceptions, and did not account for the animal's perceptions, or sorry, experiences of these relationships that they had with humans. And it really is crucial not to only understand the human experience, but the dog experience, for example, as well. And we have ethologists, we have canine trainers, we have so many individuals that can help with that side. But really, I just want to really make it really clear in my view that when we say these relationships are reciprocal, is still very human-centric. And we are working in our lab right now to try to address some of that, and in particular with the human-animal bond scale that is accounting for the role of the perspective of dogs in particular. So I'm just going to give you a couple examples of how I've done this in the past. So my whole background is in community-based research. So where I'm always working with the community in anything that I have done in the past. So when I started in this field with the dogs in 2023, I was like, okay, so what do I need to do? So now the dogs are some of my co-researchers, the other, not just participants in my research. So I went to a dog training lab in a dog psychology lab in the United States. And I spent a number of weeks there trying to learn about who it is that I was working with. And these were dogs, right? This is new to me. I always had a dog in my life since I started my PhD. But I really need to understand them better to account for them in our work. So there's an article here, and I'm going to read a little bit of that for you. And then also, we also work with veterans now with PTSD and substance use disorder. So they said, if you want to work with us and you want to understand our relationship with service dogs, then you need to train a service dog yourself. So Molly is actually the third service dog I have. She's in training right now. One has passed and the other, I wanted to work with a smaller dog. Molly is quite short, and the other dog, EJ, that has now is a full service dog. He's quite tall, and I just thought that would be a different experience, right? So again, this is very important to the veterans, and I would never be able to do and have the insight I do have in my research if it wasn't for the dogs. And then I just want to put this picture up here because this is Elder Gladys Wapa's Gray Eyes, and we were doing a project must have been 2008, working with horses, so equine therapy with Indigenous youth. And this was our big launch of the project. And I remember her standing there and she was saying, hey, it's her role, and you have these pictures of the horses. And she was like, okay, so Colleen and Ernie, who I was working with, she said, well, who's missing from this? And both Ernie and I were like, I don't know, I think we invited everyone. And she said, the horse, we are in a barn. Why do we not have a horse? And it was like, oh, of course we need a horse here. What are we doing? We're not doing research on. They have to be part of our work. So I've never forgotten that. And it's included in everything that I do and now to account for the animal's perspective the best that I can. And I just want to just show that increasingly we are recognizing the human-animal bond. I know lots of different places around the world, if people have access to bring Fido, hotels are allowing pets in. I know there's parts of the world where dogs are just a natural part of a pub, right? This is something new for us here in Saskatoon. And there is a talk coming up, and I'm going to give you the resource for this, on a childless, they call it about child-free pet parenting, and they refer to it as a global phenomenon. And across cultures, they're going to talk about evidence from the United States, India, Japan, Finland, and Hungary, and also some anecdotes from China and South Africa on childless pet parenting. So again, all that based in the human-animal bond. So pets replacing children. So I wanted to bring this up as well, is just an example of what happens when we don't consider the human-animal bond. And we treat animals and humans separately, which would be very unlike One Health. And we had Hurricane Katrina in the States a number of years ago, and they learned very quickly that if we did not evacuate the pets as well, or have pet-friendly shelters where people could evacuate from a storm or an emergency, people wouldn't evacuate and people would perish, and their animals as well. And we learned from that in Canada, and we had in 2016 wildfires in Fort McMurray, and the airlines, WestJet was one of them, but there were a number of airlines that let the animals come onto the planes immediately because they knew how important this was to individuals. So Zooeyia, that we talked about, was the role of pets in human health, right? So if we take Zooeyia, that understanding, which is one way, the pets influencing human health, and you add the human-animal bond, this is just simplistic, but if you add the human-animal bond, which is looking for that reciprocal relationship, then it brings us also to a one welfare understanding. And this refers not only to the welfare of animals, but the welfare of humans and of society as well. And then also environmental conservation. So the environment comes in, but it can also come in possibly in the ways I spoke about with my work with Darlene earlier. I want to give you two examples of the presence of Zooeyia. This is two articles that we had done, and welfare, so human-animal welfare across populations. The first one is here, looking at Zooeyia and the human-animal bond in veterans living with substance use disorder and post-traumatic stress disorder. And all four components of Zooeyia were present when we looked at the experiences of veterans with their service dogs. Though we did find that, we found that it was this reciprocal human-animal relationship that they had, but there were also challenges when we didn't embrace the understanding of the welfare of the animals, or the service dogs in particular. And if you looked at articles around service dogs and veterans, again, we do in our work, but it is often just kind of, if they're lucky, there is a sentence there, but it's absolutely vital, because if the animal is not healthy and doing really well, then obviously their role as a service dog is going to be impacted as well. And this is the article here, recognizing Zooeyia to promote companion animal welfare in urban Bangladesh. This was the work of Kamal that I mentioned earlier. And again, really found that there was a role of companion animals within Bangladesh, though there was their utilitarian role and a religious role as well, or has been kind of a pushback against companion animals and looking at the human-animal bond. But for many people, it was really important, and it was really awesome to recognize that, and we looked at that again within that Zooeyia framework. But there were also challenges as well, and that was within how was that? Yeah, for example, stigma was one area. And I just wanted to give an example. I have the article here. We saw that there were a lot of street dogs in Bangladesh, and there's a lot of organizations that try to help them as well. But we were just saying of how if you take a Zooeyia framework, you can start to look at that. For example, in northern Uganda, if people are aware, if they've seen the video, there's a project that trains street dogs to assist survivors of war to cope with their trauma. And it really highlights the benefit of the human-animal bond. So there are examples like that we gave to the Bangladesh government to be looking at. So I want to share this video, and I know I'm coming up to my time here. I am going to stop sharing for a second, because I want to show you how the human-animal bond isn't just with our own pets, but also this is the work we do with prisoners. So this is just 3 minutes, and then I'm going to end off some resources for everyone.
Colleen, is that playing?
Oh, sorry. Thank you, Deb.
We can't see or hear anything, so thank you. Thank you, Colleen.
I have to share it, that's why. And now you can see it? No, you can't. Now you can see it? Oh,
Yeah.
thank you.
You help me forget about being angry about stupid things, to help you have patience with everybody. It's almost hard to explain in words. It's almost just an experience that they give you.
Rideout said he was saddened to hear of Subi's death.
Heartbreak. Subi was a big part of the program for me. I was just so attached to him. He was like a friend.
Okay. There. And if you are interested in any other stories of prisoners and the relationship with therapy dogs, we have this magazine from across a number of institutions in Canada that we put together. So, and I always think, why do I show that video? It's so hard to watch. With the passing of our companion animals in our lives, especially when I work so closely with them, right? And then I always think, well, if the human-animal bond wasn't a thing, if it wasn't real, like, why does it hurt so much when we lose these pets in our lives, right? So, you know, on the anecdotal side, it's very, very real. And it's, again, so grateful that people are here and we can do more research into this in our understanding. Yeah, I won't go into this a lot. This is just documenting the flow of a common canine pathogen for a dog to a human. This is Joe Rubin's work with a couple others here. And this is really great work because they found there was an elderly individual who was using a catheter every day at home for his medical needs, but he was also spending many hours a day training his dog, his pet. And so then they ended up with the same bacteria. It was a common canine bacteria, but he had a UTI, urinary tract infection, and it ended up is because he was so close with his dog. Usually a UTI is E. coli, but this was a different one. Yeah, so just again, there's no alarmist here. It's just another, if you want to look at that angle, why our pets are really important to recognize in that human-animal bond. That is one example as well. And they have a number of case studies like that. So I just want to end here on some resources. If you're interested in our own work, I've been having Facebook for the last, I think it's 12 years now. I post daily. I try to do it from the dog's perspective. I've done this from the very beginning. And yeah, so you can follow us on Annabelle and Subi's Adventures. These are the 3 pups that I worked with originally who have all passed now, but are very much a part of our work still. There's a TED Talk that I did here on the role of therapy dogs in individuals healing from addiction. Lots of prisoner stories in that one. Lindsay is our co-lead in the lab, and she did a recent TEDx talk on animal welfare and how she was thinking her dog was going to be a therapy dog and wasn't, and had to come to that recognition because it was in his best interest. So it's a wonderful talk. Here, if people are interested, we have a therapy dog handler course, and this is an 8-hour course. It's free for individuals who are interested in being therapy dog handlers or who are. It talks about human welfare as well as animal welfare. We also have our work with veterans with PTSD and substance use and service dog. This is a 3-hour course for trainers, but absolutely anyone can take it. It also is free, and you'll end up with a certificate. And then this one here is animal awareness for the substance use workforce. This one is coming out in September. And again, it's about a 3 or 4-hour course, all free online. And that one you can get a digital badge. So my last slide here is we just want to keep talking. We keep on adding to this understanding we have of the human-animal bond. 2 great places, the American Psychological Association, the human-animal interaction section. That's where that upcoming webinar on childless parenting or parenting with pets is coming. I think it's going to be fascinating. You can just Google and it'll come up. And there's also the Human Animal Bond Research Institute. They're in the US, but they're one I look to a lot. They do a lot of work. And I want to end it here with this survey. This came out in 2024, I believe, or no, it came out in 2022. And it is a survey of international academic centers on the human-animal bond. And 1/3 of the centers, this is a study, what they found it here, 1/3 of the centers on human-animal bond are less than 10 years old. Most centers, 95% focus on companion animals or pets, and 95% are looking at the dog, probably for a similar reason to our own. But there was a real notable shift since 2016. This is super interesting. moving from 44% of the directors of these human-animal bond institutes were veterinarians, and now 90% have a human-focused specialty. So like maybe myself, a sociologist, right? And a lot are focused on human-animal in services. So, and this is our last slide. If you're interested in our lab, positiveconnectionslab.com, and everything's available on there on social media. And then my own website is colleendell.com. Yeah, so I think I can stop sharing now.
Oh, thank you. Thank you very much, Colleen. That was just amazing. I was so looking forward to you joining us and for you to be giving our first talk as we relaunch and that. It gives you so much to think about, and it just opens my eyes as far as, you know, the amount of research and the thought that's going into our relationships with animals, and how they benefit us in ways that, you know, nearly seem to be invisible, but when you really start to look at it and find ways to measure it, that it really is there and it does have positive impact. I know in the talk there, the chat, that there were a few comments about the bond as it relates to kind of our one-on-one relationship, you know, that interaction and that bond at the heart level that we have in so many of perhaps the more developed countries. And then we also have other relationships with animals which are more functional and related to survival and related to you know, people being able to feed their families. And so it's a little bit more agrarian related. So would you want to speak on that at all? Just make a comment on that?
Yeah, I absolutely. And I just think, as I was just looking at some of the comments, it's looking outside of perspective of like species and as a human, right? And how we have used animals in the past. And I think even for me, just small changes, people are always like, well, how do you use the dog in the prison? How do you use the dog in the emergency department? My first comment is, we do not use the animals. We're working with them the best that we can. I'm not saying we're doing it perfectly, and I perfectly understand, for example, Molly's perspective, right, in any way, but I try, and we bring on individuals like canine trainers. There is also human animal communicators, right? There's so many ways that we can be doing that. So I think that's the first, is even just simple things like looking at our own language and trying the best we can to even out that playing field, even though it is not even in any way. Oh, Molly's done. She's like, I'm out of here.
Yeah, and I like that point, that concept of evening the playing field, because I think that also draws on the Indigenous views, worldviews, and that interconnectedness. And in fact, they often view us as the younger sisters or brothers of our animals, and that we can learn from the plants and the animals, and they were here before us.
You know, when I did my first that training that I did in the States around dog psychology, is she asked us, the question was, from the dog's perspective, will you still love me when you understand who I really am? And I remember going, well, I know who you are. You're a dog, right? Was my mindset, even though I loved my pets and so forth. And so it was like, yeah. And then I came away after it was nearly a month of living with Annabelle at the time and training dogs there. And it was just like, I had no clue. I had no clue who you were. And I have such respect that she, and I'll just say the dogs living in my house, do so in such a seamless way, given all the things that go on in a house and how inconsistent I can be with them and so forth. 1 minute I'm petting you, the next minute I'm ignoring you because I'm on my phone, right? So it's, yeah. Anyways, I just wanted to share that.
No, thank you. Yeah. I'm wondering, would anyone like to ask some questions for Colleen? I see it's Jay here. Would you like to go ahead, please?
Hello.
Hi there.
Thank you very much for the wonderful talk, Colin, because it's very inspirational for me. I am thinking in a similar concept that there is not exist in the literature, that is zoonoethics. But
Right.
because exists the ethics of zoonosis, but not related in connection with the One Health approach. But I have a question that is, if Zooeyia refers to the human health benefits of interaction with animals, why not talk about zoonophilia better? What is the meaning, the specific meaning of eia? What does it refer to?
Oh, and I should know this. And there, I forget where the Aya part comes from. You know what?
Because I think that zoonophilia probably refers to the similar terms or the similar connection. The philia is the contrary of the violence to animals and nature and environments, and develop zoonophilia probably refer to the human-animal bond too. But in my terms, I am a philosopher. I don't catch very well what is the meaning of eia, but it's very intriguing for me.
Yes, and I honestly, I just can't remember right now, and I should know this, but it is, if you look on Hodgson's and Darling's article, it says right at the front, they pulled the words apart and what the initial meaning was. But I just cannot remember right now. Sorry.
Yeah, I have another little question. That is, I am not sure if Zooeyia quite effective in countries with structural poverty problems. For example, in Colombia or Bangladesh, a lot of people don't can afford flying with companion animals. I think that this is a luxury that more than half of world population cannot afford. And for this reason, I think that there is a problem in promote zoonophilia or zoonoeia, because probably is a luxury.
Absolutely.
Fly with companion animals increase the CO2 emissions finally, and this is not very well not fixed with the One Health approach that include reduced emissions.
Absolutely, 100%. And I see someone just put pets are a huge built industry, 100%, right? And so again, Zooeyia is looking at that relationship with the companion animal in a very Western frame. And again, the impact of the animal or companion animal on the human, right, on their benefit. So it is very, very one way. And that's where I was saying at the beginning, that idea within also looking at our relationship with nature, like biophilia hypothesis, our relationship, say, as a farmer with their own cattle, that they're understanding, you know, in a lot of our work, we talk about connection. I'm talking about human-animal bond here, in that very square, but we talk about our connection and our connection with others, our connection with the land, and our connection with humans. And that is a more comfortable term for me, because it could be me walking down the street seeing, you know, for here, a prairie dog that I connect with, right? And so that I think expands it a lot more beyond what I was talking about here. But I mean, we were looking at some of the data, and in North America, forget it was North America, the US, people spent more on their pets than they did on dental care for their children. Right? More money was going into, and it's just like, wow, like it is such an industry. And as a sociologist, I absolutely recognize that. But it's also something to see, especially if we start thinking about things like people having pets instead of children. Like it gets complicated really fast, but it's really important for us to be looking at this, right? So I really appreciate what you said. And I think Wendy had a comment too of, I mean, even in Canada now, I mean, we are in different economic times and animals are suffering for that as well because of economics and so forth. So.
Yeah, thank you for that. Thank you for the question and thank you for the answer. And I'd like to add that I think, to be a healthy and well-connected and well-grounded human being, I think it's important for us to be as connected to all aspects of our world, no matter where we are and no matter how we relate to our world, the different aspects, including, our biosphere. So, and that even makes us more human. And influences our relationships to other human beings, not, even our relationship that we have with the natural world influences our interhuman relationships as well. So we can take much good from things when we look at things openly. So perfect question. And perhaps I think we have time for one more question. Perhaps, Victor, would you like to ask your question?
Yeah, good afternoon. I'm Victor from Nigeria. I'm a medical sociologist. Thank you, Claire, for the wonderful presentation. I think I've gone through your profile through online. I saw the work you've been doing and even on your site. Well done. My concern now is I'm into One Health approach, trying to look at the human-animal interaction, a project I'm handling now, trying to look at the zoonosis, outbreak between the relationship between man and human interaction and the environment. Now, from the African context, especially when you look at from the Western world, the relationship between their pets and the animals has no cultural inclination. Is a norm, is a normal thing where every household in the Western world should have a pet, understand? But when you now come to the African context, there's this cultural belief and cultural inclination that is tied to some pets, to some animals. Now, and the knowledge of these zoonosis from man to animal, most of these rural, especially from the rural dwellers, they don't have the knowledge of zoonosis and how to care for this animal. Now, in the process of us, because we are looking from the context you are coming now, you are coming from the Western perspective. So there is a need to do a kind of a comparative study for the African context, so that because now white people don't see the need for this, the relationship with pets, you understand? Because from the little study I've done, from the qualitative ethnographic study, you find out that there is some religious belief to some people. Recently, I did an ethnographic study on bat festival. Some people eat bat, understand? Some people see the bat as a pet that they keep to make them stronger, understand? While some see it as a negative animal species. But literally, the bat has so many benefits to the human society, but because of the negative influence that people read to it, they tend not to have any association with the bat. So also to cats, to dog, you understand? So just very few, from the African context, that you see that people have goats, and the goats is just because they use it for economic value, economic uses. So the bridge now, there is a gap. So what should be done? What can we do, you understand, to see how we can now do a kind of awareness, you understand, because there's a breach of knowledge base of the uses of the benefit of these pets, you understand? Because you also, when you now come to that, you find out that there's a lot of emotional and psychological problem among our people. And from what you said, most of these animals can be as a kind of therapy to them, but when you go to tell them that, they won't believe you, because it's a strange thing. It's just like an alien to them. So what is the gap? What are we going to do, you understand, in order to bridge this knowledge gap, you understand, so that these people from the rural area can see how best they can value these pets. They can take this pet to see the health benefits of it among them. So that's my concern. And secondly, what has been put in place, because some of these animals, like the Western world, most of them don't go out, you understand, is an indoor pet, you understand. So the level, the prevalence of zoonosis will be very, very minimal because they don't go out to eat and to eat other things. So having contact with some of these outbreak is very, very minimal. So now what can we do? Also now fall back to the African context and to the low income society, that most of these are pets, those who have the pet, that they allow the pet to roam around the community, pick most of all these rodents, which most of the rodents are infected. So when they eat those infected rodents, they come back up and share the spillover of this zoonosis. So there's a gap that we can see how what can be done in order to bridge this knowledge gap. Thank you.
Yeah, I think, thank you for that. Thank you very much. And a couple of things there I'm thinking about, but mostly there is such a need for that sharing information within a specific space and then across. I could listen because I have interest in this, and I'm sure many other people on do too, of seeing what's happening cross-culturally, right? And there is so much to learn from that. For example, I think about in Canada on reserves, there's lots of feral dog populations, and sometimes there's cullings, and there's people wanting not to have the cullings of the dogs, like the killing of the dogs when they're free and they're roaming. They're probably very similar in different parts of the world, right? So Canada also is not just one blanket of how pets are considered or how they're treated or what have you. One really kind of microcosm, one very small part of that. I think about in Bangladesh and our work there with Kamal, and it was, again, lots of stigma, lots of religious beliefs. There was a lot of tension there when it came to dogs. But the way that we were dealing with that there and what we were trying to do is looking at the Animal Welfare Act. It came into being in 2019, the newer form. So, again, if you're going to make change, all these different levels. But as you're saying, Victor, that sharing of information, I think, is so important in different ways. And sometimes when the information comes from outside, people are more willing, not always, right? But sometimes they're more willing. Sometimes they're more willing to listen than when it comes from the ground up inside, working and influencing leaders. But the one thing I think about in everything that you shared, and maybe I'll leave it at this, is the role of technology now, right? Is how we are sharing so much of what's happening. So the influence in Bangladesh, for example, of the role of pets, we heard from a number of people that was because they were seeing cat and dog videos on YouTube, right? And so they were like, oh, what's this dog in this relationship? And now the dog's living in the house. A lot of people don't like that. But again, the influence of technology, social media, and all of that. I think the number one videos or one or second video is dog and cat videos on YouTube, and where people are seeing this relationship. So I don't think that answers your question, but it is about the sharing of information. I think that for us as a One Health community to grapple with all this, because we're really interested in starting a group in One Health Social Sciences that looks at human-animal interaction broadly. Human-animal bond is just one component of that. But I would be super excited to work with others and to have these discussions and start to move it forward. And I'm just noticing, Debbie, that we're over time now.
Yes. Well, that's a perfect note to end on, to bring this to a close. So, yeah, and it's all about learning and sharing, which is exactly what we're doing today. And we can learn from each other in every different direction, right? It's not that one worldview or perspective is right nor wrong or anything like that. It's about learning and sharing. So thank you. And this is what this is all about with having these webinars. And we're hoping to have 3 to 4 of these webinars per year. This is our first one. And I want to thank you very much, Colleen, for being our first guest speaker and sharing. We're just so excited about that, and loved your presentation. And it's given us obviously much food for thought. And I would like to thank all of you for coming and attending today, and let you know that this recording will be posted, so you'll be able to view it again. And for those of you who didn't attend, they will be able to view it. And as a reminder too, I'd just like to let you know that our next membership meeting is on June 27th, and that's at 10 a.m. Eastern Daylight Time, and we will be sending out a notification for that. And again, the survey is coming up within the next week, and please fill it out. This gives you an opportunity, like you can see how much we shared and learned and raised different questions today. Just think if you were taking a deeper dive into the One Health social sciences at this level, at the leadership level. It's a great opportunity. So good to see you all. Thank you very much. And bye for now.
Bye-bye.
Bye.